Let's finish off this learning plan talking about Parkinson's. Parkinson's disease, it's a neurological disorder characterized by muscle tremor, rigidity, and lack of coordination. It's believed to be a neurotransmitter imbalance, so drug therapy is aimed at correcting that imbalance. It's not curative. It is palliative or symptom controlling. It's a chronic progressive disorder, primarily disease of the older adults, but it can develop in people under 40. About 1 million Americans, usually at about 55 years, begin developing this. Men and women are affected equally. There's an imbalance of two neurotransmitters, dopamine and acetylcholine. There are no lab tests that can detect or confirm Parkinson's disease. CT, MRI may rule out other diseases as a cause of the symptoms, but this is a disease more of exclusion. You've ruled out everything else, so it must be Parkinson's. We're looking for a balance between acetylcholine and dopamine. When symptoms occur when the dopamine is depleted. So we're looking at finding ways of preserving the dopamine in the system. Again, the symptoms include rigidity, tremors, dyskinesia, bradykinesia, akinesia, muscle weakness, and alterations in posture and equilibrium. So tremors are less severe during voluntary activity. It starts on one side, progresses to the other side. But when you have somebody do something, the tremors sometimes frequently go away. Dyskinesia is the impairment of the individual's ability to perform voluntary movement. Usually starts with one hand or one arm and usually stops swinging the arm on the effective side. Chorea is irregular and spasmodic involuntary movements of the limbs or facial muscles. Dystonia is abnormal muscle tone of any tissue. Bradykinesia is a slowness of movement. And akinesia is an abnormal state of motor and psychic hypoactivity or muscle paralysis. And it creates that mask-like facial expression and impaired postural reflexes. If you've seen somebody with advanced Parkinson's, it almost looks like they have a mask on their face. There's just no expressions. Symptoms start slowly with weakness and tremors and gradually progress to involve movement disorders throughout the body. Symptoms begin on one side of the body, progress to becoming bilateral. Usually the upper part of the body is affected first. Eventually the individual has postural and gait alterations which result in the need for assistance or with total care needs. High risk of falls and injury with Parkinson's patients. Drug therapy is aimed at increasing the levels of dopamine as long as there are functioning nerve terminals. It's also aimed at blocking the effects of acetylcholine and slowing the progression of the disease. So okay, it's twofold. Preserve dopamine and prevent acetylcholine. So let's talk about some anti-Parkinson's agents, dopamine agents specifically. Levodopa is a replacement, and Carbidopa-Levodopa, or Cinemet, is very commonly used. There's also Symmetrol, or the generic is amantadine. It's a dopamine modulator. These are given orally. Dopamine does not enter the brain. That would be just far too easy. Levodopa crosses into the brain and is metabolized into dopamine. It replaces the dopamine deficiency at the basal ganglia. So we talked earlier when we were looking at cardiac medications and using dopamine IV. Well, you can't do that to get dopamine in the brain. So we give the person's levodopa. Carbidopa is an enzyme inhibitor that reduces the metabolism of levodopa in the peripheral circulation, which allows the dopamine greater ability to cross over into the brain. So levodopa alone will not give as good a function as Carbidopa-Levodopa, because that Carbidopa is a protector agent, and it kind of is armor to allow that levodopa to cross into the brain and then be converted or metabolized into dopamine. Carbidopa is used to reduce the dose of levodopa by about 75%. It increases both plasma levels and the plasma half-life of levodopa. Wait 8 hours after the last levodopa dose before switching patients to Carbidopa-Levodopa. We need to obtain a history of GI and cardiovascular problems. Ask about hallucinations, nightmares, dementia, or anxiety. And we're going to screen for the presence of angle closure glaucoma. We use dopamine agents, either plain levodopa, the combination Carbidopa-Levodopa, or the amantadine for relief of tremor and rigidity in Parkinson's patients. And the combination medication is much better tolerated than simply the replacement. There's a diagram that shows the action of dopamine in the brain and how the dopamine agents amantadine works. Now we have, those are dopamine agents. Here's dopamine agonists. Dopamine agonists have extrapyramidal side effects. So when you're giving Carbidopa-Levodopa, you need to watch for those extrapyramidal side effects: dizziness, hallucinations, psychiatric problems. You can have an off-on phenomenon where it works, then it doesn't work. Nausea, vomiting, dry mouth, hepatotoxicity. The orthostatic hypotension is common. Palpitations, blood dyscrasias, darkening of the urine. Okay. Quick story, when I was a new CNA, brand new CNA, I was putting a gentleman to bed who had Parkinson's, and as I was getting him ready for bed, he voided all over the chucks, and it looked like blood. And I panicked. I went to my nurse. I go, I think Mr. So-and-so has blood in his urine. It's really dark. It looks orange-red. And she's like, he's on Cinemet. I'm like, remember, CNAs aren't taught medications. So she explained to me that the side effect of Cinemet is dark urine. It's almost red-orange. Startling, totally harmless. Do not use with narrow angle glaucoma or with lactation. There's also some drug-food interactions. Food with large amounts of paroxetine may reverse the effects of levodopa. Paroxetine is vitamin B6. In oral doses of 5 to 10 milligrams reverses the therapeutic and toxic effects of levodopa. Normal diets contain less than 1 milligram of paroxetine. So we're just going to watch for vitamins. If a person is taking high-dose vitamins, especially B vitamins, that can be a problem. Orthostatic hypotension usually goes away after a few weeks of treatment. Adding carbidopa limits the on-off phenomenon that patients that take levodopa alone experience. Long-term effects: abnormal movements, facial grimacing, rocking. You'll see this a lot. And if you can't see it on the video, you'll see it in the class. Chewing motions, hand and neck bobbing. Those are just side effects of long-term use. COMT inhibitors. COMT inhibitors like Tamar and Comtan. Tamar is tolcapone and Comtan is entacapone. These inhibit COMT, which is an enzyme responsible for the breakdown of levodopa. And it prolongs the duration of the levodopa benefit. Now, we gave Cinemet or Carbidopa-Levodopa because carbidopa is that shield that allows the levodopa enough time to get into the brain and then be metabolized into dopamine. COMT inhibitors eliminate the need for carbidopa because it inhibits the COMT enzyme, which breaks down levodopa. This prolongs the duration of the levodopa effect, which is huge, really important. Remember, levodopa is the only way of getting dopamine in the brain. The longer we can have levodopa in the circulation, the more that will get in the brain, the better the symptom control. Again, this is used for relief of tremor and rigidity of Parkinson's syndrome and decreases the on-off phenomenon. Both of these agents, the dopamine agents and the COMT inhibitors, are used for the tremor and rigidity. Should be taken at the same time as levodopa. It can cause GI upset, urine discoloration, and increase dyskinesia. Tolcapone can cause severe liver failure. These would not be the first choice of medications, simply because of the side effects. MAO-B inhibitors, not MAO-I inhibitors, MAO-B inhibitors. Eldepril is the brand name, generic is Eldepril. We'll call it that. This reduces the destruction of dopamine within the brain, which allows greater dopaminergic activity. So this works in the brain. It selectively inhibits the MAO-B brain sites, which results in greater amounts of available dopamine. So the first drugs were pushing levodopa into the brain, which was converted to dopamine. This protects the dopamine already in the brain. It improves memory and motor speed. It has a neuroprotective effect by interfering with the degeneration of neurons. It may increase life expectancy. It's used early in the treatment of Parkinson's to slow the progression of symptoms and delay the initiation of levodopa therapy. Only 50 to 60% of the patients show a positive response. Monoamine oxidase is one of the major pathways by which dopamine is degraded. By blocking that enzyme, it causes an increase in the levels of dopamine within the CNS. It can be used as an adjunct to Carbidopa-Levodopa dosages. After 3 days, the Cinemet, Carbidopa-Levodopa, can be reduced 10 to 30%. Side effects, though, every medication has side effects. It increases the dopaminergic effects of levodopa, so it can cause confusion, hallucination, dyskinesia, ataxia. Again, back to orthostatic hypotension, tachycardia, and dysrhythmias. Dry mouth, nausea, abdominal pain, anorexia. EPS, extrapyramidal side effects. There are some few episodes of hypertensive crisis with low dosing when they're also eating tyramine-based foods. Remember tyramine and the MAO-Is? That's why tyramine and MAO-B inhibitors are a problem. Avoid concurrent use with meperidine, SSRIs, or tricyclics. And hypertensive medications, the doses may need to be increased when using this. It can also cause chorea, which is that rapid jerking, dance-like movement of the body. Side effects are usually mild, though. Doses higher than 10 milligrams a day cause more severe side effects. And you do not need to worry about tyramine-containing foods if you're giving doses of 10 milligrams or less. How about anticholinergic agents for Parkinson's? Cogentin is benztropine mesylate, and Chemidrin is procyclidine hydrochloride. These are used to reduce the hyperstimulation caused by excessive acetylcholine. Remember, we're looking at Parkinson's as a balance between dopamine and acetylcholine. This is going to affect the acetylcholine part of the problem. Reduces the severity of the tremors and muscle rigidity and drooling, which is associated with Parkinson's. And it also reduces extrapyramidal reactions. Excess acetylcholine causes that muscle tremors and rigidity. The tremors are usually worse while the patient is at rest and consists of pill rolling, like this, and bobbing of the head. These medications are more useful for patients with minimal symptoms and no cognitive impairment. So early onset, early in the disease process. They do little to relieve the bradykinesia, or extremely slow movement associated with Parkinson's disease. Combination therapy with levodopa and anticholinergic agents is successful in controlling symptoms of the disease more completely in about half the patients. They have little effect on rigidity, though, bradykinesia, or postural abnormalities. If anticholinergic agents are discontinued, it should be done gradually to avoid withdrawal effects and acute exacerbation of Parkinsonism. Paradoxical effects to anticholinergics can happen to the elderly, which would be excitement, confusion, or irritability. Overheating is also a problem in patients using anticholinergics, so we need to avoid excess exercise during warm weather. And side effects. Got to talk about side effects. Blurred vision, constipation, urinary retention, dryness of mouth, throat and nose. Those are the classic anticholinergic effects. Palpitations, arrhythmias, orthostatic hypotension, just like almost everything we've been talking about. Nightmares, confusion, hallucinations. Contraindications, again, not with narrow angle glaucoma. Prostatic hypertrophy would be a contraindication. If they already have tardive dyskinesia or myasthenia gravis, we won't be using this. Large doses of anticholinergic agents may slow gastric emptying and inhibit absorption of levodopa. An increase in the dosage of the levodopa dosage may be required. Involuntary rolling of the tongue and twitching of the face or trunk or limbs can happen. This often occurs in patients with Parkinsonism who are treated with phenothiazine. So nursing considerations, we have to monitor for orthostatic hypotension. Teach them to get up slowly and get assistance with walking. Monitor for psychiatric disturbances. Use hard candy for those using anticholinergics. The hard candy helps stimulate saliva. Avoid foods and medications contain peroxidine. That limit is 10 milligrams or more, but it's better to be just not have it, just limit it as much as possible. Give these medications with foods to avoid GI upset. Fluid intake and frequent mouth care should be encouraged because of the dryness of the mouth. Risk is lower with Carbidopa-Levodopa. There can be impaired physical mobility, risk of constipation, risk for injury, disturbed body image, and ineffective management of therapeutic regime. So those are the treatments for Parkinson's disease, a disease that cannot be cured, but we can only slow the progress of the symptoms. That's it for this learning plan. Enjoy.